Many women find their bodies change quite a bit before, during, and after baby.
But there are professionals who can help no matter how long ago you went through it.
I sit down with Kayla Lear and Maddie Westby at InReach Physical Therapy to learn about how they can help. Thank you both for being with us today.
Thanks for having us.
Always good to have you. Know, some people have actually tried physical therapy in the past and maybe they didn't have the best experience or it didn't work. Can you talk with us about InReach Physical Therapy and what makes you stand out from the rest?
Yeah, we have lots of different certifications. We make sure to have our therapists go to the utmost best continuing education out there. It's expensive, it's time consuming, but it is totally worth it and has helped us so much be able to treat our patients with the best techniques possible, so they're getting better faster. And we've also added specialties like pelvic floor, dizziness, all of that good stuff. So it's nice to have those that can hone in on those skills and be the expert.
You're talking about pelvic floor, and that leads us into a lot of women's health issues that you might see, as we mentioned earlier, before, during, and after baby.
All of it.
We all go through a lot of changes through that process in more ways than one. What kinds of issues do you help female patients with specifically?
Yeah, there's tons of, different impairments that we see all the time, and a lot of people honestly chalk them up to be as common or normal because, oh, you're pregnant, or oh, you're postpartum, it's going to take a while. But the most common things that we want to help people with are anything from constipation, urine or fecal incontinence, pelvic pain, right? Obviously, you just had a birth, whether it was vaginal or C-section. There's so many different things that can be hurting, whether it's your back, your hips, your pelvis, down in your pelvic region, abdominal pain, right? And so with a lot of that, there's all sorts of different issues that usually people aren't breathing right, they're not moving right. So it's all things that a physical therapist can help with.
How soon after you've given birth can you start seeing a physical therapist?
Kayla loves this one. I will touch on it. We like to say, honestly, you can stop on in when you're going home from the hospital because there's anything, that you're struggling with or it was traumatic, obviously just someone to talk to. I know for a lot of our patient stories is they want to wait for that 6 weeks because they're going to get all the answers, and sometimes that's just too long, right? So whether it's simple relaxation techniques or if they did have a C-section, what are some good relaxation methods where they can breathe and soften their belly so they're not gripping in pain, and then now you have to lift a baby and move throughout, your home and do your somewhat normal activities, but we don't want them to hurt or be in the dark by any means. So if we're not the provider, we'll definitely help guide them into a professional that would help them.
Mm-hmm. And if you are expecting, can you go up until the day before?
Yeah.
Yes.
And how can that help someone? I remember what it was like for me. You're carrying a lot of extra weight, you can have some extra back pain. Mm-hmm. How can seeing you help during that time?
Yeah, there's tons of body changes, obviously, that we know, whether, just weight translation throughout your body. Honestly, we have women with cramping, right? How many times do pregnant women have leg cramps, calf cramps? It's like, well, we don't really want that to happen, right? So as simple as from head to toe, honestly, neck pain with changes in their chest and shoulders. But we honestly love the end time, and that's usually when we start honing in further because labor is a marathon, right? You need to be ready for it. You need to be strong enough to get into some of the positions that your doctor, your OB, your midwife, your nurse might have you in. So it's not fun if you're already having hip pain or back pain and then you get put in a position that really hurts, and then now you're having that pain in labor, but then you're needing to also push through labor. So
yeah, something I also like to work on a lot with women that get up to that point is, how do you push? Mm-hmm. How do you push, right? Nobody teaches us, and all of a sudden we're thrown in this bed and it's like, okay, there's a contraction, push. So it's nice as we do internal work and we can help women recognize what those muscles even feel like and how to properly do a contraction or a push with a contraction so that they're actually laboring properly.
Yeah.
So.
And
it's so true.
Yeah. Yes, it is. You don't know how to do it, right?
Until you're expected to do it, right?
Yeah, and just like with that, like just decreasing with that internal, just decreasing any tension that might be still lingering before the birth. So trying to get rid of any tearing that could or may happen and try and lessen it to any advantage that we can.
Yeah.
All right, and then you have Healthy, Happy Baby, and then you stop in and see you two at InReach Physical Therapy the day after.
Yes.
What else do you want to know, female patients in particular, about why they should stop in and what they can get from InReach Physical Therapy?
Yeah, I think honestly, people ask all the time, you know, who should come to physical therapy for their pelvic floor? And we see as young as teenagers that are struggling with bad periods. You know, it is not what it is, right? We want it to be better. We don't want you to miss school. We want you to be comfortable and happy. So just teaching them some different things. And then obviously we talked a lot about like the pregnancy and postpartum. But then a big thing too is that menopausal shift too. Like, yes, there's things outside of our guidelines with medication management for hormone replacement. That's obviously what we look to our providers for, but just helping them through those different stages so that they're not questioning if this is okay, if this is normal. So-and-so went through it, so therefore it's probably normal. Honestly, I think if you're questioning anything regarding your abdominal, pelvic health, then I think it's an easy way to just come from a provider that has a long session to listen and you know, give you really good recommendations. And like I said earlier, I love our profession because if we can't help you, we usually know someone who can, and just leading you in a better direction.
Yeah. I also like we hear a lot, I've had incontinence for 30 years. You're probably not going to be able to fix it. And we can. There are things out there, just because you've had incontinence for 30 years or you've had chronic constipation your whole life, there are some really easy things that we can do to help that. So there's no time frame that is lost or that is perfect. It's when you're ready.
And it can be life-changing for someone. What I really like about InReach is you don't need a referral from a doctor. Talk to us about that direct access to getting that appointment.
Yeah, that's awesome. We are really, really grateful for that in North Dakota. You do not need to have a doctor's referral to come and see us if you have anything going on or you have any questions, back pain, neck pain, pelvic pain, pregnancy, literally anything. You just give us a call, and our front desk is fantastic, and they will guide you through absolutely everything.
Yeah.
And InReach Physical Therapy has 2 locations in Bismarck, and to make an appointment, call 701-450-1330.
You can also go to InReachPhysicalTherapy.com.